Welcome to CSIS Online. The way we bring you events is changing, but we'll still present live analysis and award-winning digital media from our Dracopolis Ideas Lab. All on your time, live or on demand. This is CSIS Online.
Good afternoon, and welcome to this special discussion on political polarization and social division in the COVID-19 context. I'm Catherine Bliss, Senior Fellow with the CSIS Global Health Policy Center, and it's my pleasure to have the chance to host this event today. Now, last July, CSIS joined with the London School of Hygiene and Tropical Medicine's Vaccine Confidence Project to launch a high-level panel on vaccine confidence and misinformation, paying particular attention to the implications of vaccine hesitancy, particularly around COVID-19 vaccines, for national security. And as we met with the 25 experts from the public health, national security, and social media, digital technology sectors, and particularly as we delved into the flows of misinformation and disinformation about COVID-19 on social media platforms, both domestically and internationally, it really became clear that we were looking at highly fragmented social groups, that people were not necessarily talking with each other about vaccines or even to each other about vaccines, but were rather, sticking within their own networks and communicating with people who already shared similar perspectives. So it perhaps, was not a surprise to learn that the Pew Research Center's new report is titled "People in Advanced Economies Say Their Society is More Divided Than Before the Pandemic." Drawing on phone or online surveys of public attitudes in 17 high-income countries in North America, Europe, and Asia, the report concludes that a key point of division is disagreement about whether restrictions or public activity have gone too far to combat COVID-19. But what is perhaps surprising is that there's a fair amount of difference among countries in terms of how much division people perceive, decidedly mixed reviews and assessments of economic responses, particularly in the European Union, and a great deal of difference among demographic groups and political outlooks as well. So here with us today to share details from the recent report and to engage in discussion with participants is Jacob Poushter, Associate Director at Pew, where he works with the Global Attitudes Project and focuses on the international image of the United States and perceptions of global threats. Now, Jacob is going to share some slides that really capture the results from this multi-country assessment, and then we'll turn to questions from the participants, the audience here today. Since we're virtual here, please submit a question either via the tab on the YouTube page through which you might be viewing, or directly through the event page, and we'll try to get to as many as we can in the time that we have. And I want to thank the CSIS AV team and my colleagues, Mackenzie Burke and Amit Mandavili within the Global Health Policy Center for their assistance in setting up this event. So Jacob, over to you. I know you've got some slides to share with us and look forward to, hearing some of the details about this really comprehensive assessment that you've undertaken.
Well, thank you very much, Catherine. Thank you for having me here. I'm very excited to share this recent research with everyone at this presentation. So with that, I'll just go ahead and start sharing my content, and we'll go through some of the findings from this research that are on our website. So you can access it at any time at pewresearch.org. And it's, as Catherine says, it's international public opinion on the COVID-19 pandemic with a focus on how politics sort of intersects with this issue. Just a brief overview of the Pew Research Center for those who do not know. We're a nonprofit fact tank that informs the public about issues, attitudes, and trends shaping the world. We're a subsidiary of the Pew Charitable Trusts, which is our primary funder. And our goal is to generate a foundation of facts to enrich public dialogue and support sound decision making. So that's why we talk with people around the world, including organizations like CSIS, to sort of let them know what people around the world think about these really important issues. And obviously politics, COVID-19, these are all very important issues for international relations. And it's good to know what the people think about these issues when sort of crafting public policy. So this survey was conducted in the spring of 2021. It was done in the US via our online American Trends panel and weighted to be representative of the entire US adult population. So these are nationally representative samples. They represent the entirety of the populations within these countries. And then the survey also was in 16 publics around the world between March and May. These were all phone surveys. So in Europe, Canada, and East Asia and the Asia Pacific, it was telephone surveys, again, nationally representative samples, which means they represent the sort of demographic makeup of the countries and publics that we're talking about here. One thing to note about this is the survey dates. The US survey was done a little earlier due to a quirk of scheduling, and the other surveys were done really in the March-April time period, some stretching into May, and that does have an impact on what you see in some of these findings. Obviously, the COVID-19 pandemic is a fast-moving event, and often in public opinion, opinions can change over time or even in brief periods of time. So keeping those dates in mind will help sort of interpret the data as we go along. So briefly, just to start, we asked a very basic question on how each country is doing a good job or a bad job in dealing with the coronavirus outbreak. And here there's some interesting findings already off the bat. First of all, in Europe, ratings tend to be pretty high in most of the countries we survey: Sweden, UK, Greece, Italy, Netherlands. In those places, majorities say that their country has done a good job of dealing with the coronavirus outbreak. And the same is true for Canada. But in the United States at the time, now again, this was early February, a majority of Americans say that the US was doing a bad job of dealing with the coronavirus outbreak. And in Spain and in France, more than not, people said that their countries were doing a bad job. But overall, in these European countries, fairly positive ratings for how the countries have handled the coronavirus pandemic so far. Looking at East Asia, pretty positive in Singapore, New Zealand, Australia, Taiwan. Again, keep in mind, this was in the March-April time period. My assumption is that these numbers have come down a little in the very good category since then because of the recent outbreaks, but overall more positive than Europe. And then you see Japan here, which really sticks out as a place in East Asia where there was much more negative views of how their country had handled the COVID-19 outbreak. And this was right before the Olympics. So, again, opinions might have changed since then, but pretty negative views of how Japan had handled the COVID-19 pandemic, especially compared to the rest of the Asian Pacific countries that we survey. And overall, you see the median down there. Most people were happy with how their country has dealt with COVID. And this is interesting because that compares differently to what they think about how other countries have handled the pandemic and how the WHO has handled the pandemic. So we asked people what they think, how Germany, how the World Health Organization, how China, how the European Union, and how the United States have handled the COVID-19 pandemic. And generally, people around the world in these 17 countries were fairly positive on Germany's reaction to COVID-19, their own country's reaction, and the WHO. However, they were more mixed about how China has handled the pandemic, how the EU has handled the pandemic, and overall, they were pretty negative on how the US has handled the pandemic overall. And I will show you later on, this was a change from last year, but still, generally people rate their own countries higher than they do other international organizations, with the exception of Germany, which is very interesting in many ways. Another thing to note about this data is that over the past year, attitudes about their own country's coronavirus response have become more negative in many of the countries in which we surveyed. For example, in Germany, when we asked this question in the spring of 2020, 88% of Germans said that their country had done a good job of dealing with COVID-19, and that had dropped to 51% in this past year. Same sort of decline in the Netherlands, Canada, Japan, South Korea. And I think this will speak to data that I will point to later on, but generally, at the first part of this pandemic, people were a lot more optimistic about what this would mean in their country. And as the pandemic sort of dragged on, as things sort of changed, people became more pessimistic over time. And it also became a little more political over time, which I think helps to explain some of these findings and changes over time. The only country actually where we saw an increase in those saying that their country had done a good job of dealing with the outbreak was in the UK. Again, this was a survey done in the March-April time period. Obviously, the UK was one of the fastest in terms of their vaccination campaigns. And this might explain why the UK number had jumped while all the other countries had sort of fallen as the vaccine rollout was a little slower in these other countries. We didn't survey Israel. I'm guessing you would find similar things there with a much more positive response to how their country is handling the pandemic as sort of the vaccine campaign started to really kick off in all of these countries. So we also asked about whether the World Health Organization has done a good or bad job of dealing with the coronavirus outbreak. And you'll note here that the ratings for the WHO are really positive. Every country that we survey in Europe and North America, a majority say that the WHO has done a good job of dealing with the coronavirus outbreak. And generally, when we ask about international organizations like the UN and the WHO, people tend to like those international organizations overall, but they also say that they're doing a good job in this context. So it's important to note that while in the policy world, there might be questions about how the international community has handled this pandemic, overall, when we ask people about it, they tend to give the WHO positive marks in Europe and North America, and in most places in East Asia. So Singaporeans, people in New Zealand, Australia, they're all positive on it. Where you do see more negative views of the WHO, it's interesting here, the three countries where it's much more negative is South Korea, Japan, Taiwan. That's mostly tied up with sentiment towards China, which is pretty negative in these countries, and goes on to explain why the ratings for the WHO might be so low in those countries compared to everywhere else where we ask this question. So that's another interesting twist on this. The pandemic and its response are not isolated just to internal politics within the countries. It also, deals more with how countries view their place in the world and international affairs in general. And to that point, even though sort of opinions on whether the US and China have done a good job of handling the pandemic, they're fairly low compared to some of the other countries we asked about, but opinions have actually improved quite a bit over the past year, especially on the American response to COVID-19. This is in conjunction with sort of overall more positive views of the United States with the transition from President Trump to President Biden, more confidence in the US president. But you see it here that in many of the countries that we surveyed in both 2020 and 2021, there's been double-digit increases in those who say that the US has done a good job of dealing with the coronavirus outbreak. However, it's still not majority opinion in many of these countries. And so for the most part, there's still the view that the United States has not done a good job of handling the pandemic. China is a bit more mixed. It's up in many of these countries, and in some countries, there are majorities that say China has done a good job of dealing with the pandemic, such as in Belgium, Spain, Netherlands, Italy. But again, in East Asia, in Japan, South Korea, few people say that China has done a good job of dealing with the pandemic, even as overall ratings for China have gone up. In Europe, in the European Union, opinions have gone down in Germany, which is a very important country, obviously, for the European Union. But overall, sort of sentiment is a bit more mixed there, where there's been some ups, some downs, but generally views are fairly similar to where they were last year if you take it in the aggregate. So what do you, when looking at the internal reasons why opinions of their country's handling of COVID-19 might have changed, one thing we wanted to ask about is whether the restrictions put into place over the course of the coronavirus outbreak were appropriate, so the restrictions were about right, whether there should have been fewer restrictions or whether there should have been more restrictions. So the overall median, when you look at the countries across Europe, is sort of like most people say that the restrictions were about right, but an equal number say that there should have been more restrictions. And in many countries, pluralities, and in some cases, majorities say there should have been more restrictions. So sort of in the UK, 50 to 37, Spain, 46 to 40. The sentiment is that more restrictions would have been appropriate. In France, Germany, Belgium, Italy, Netherlands, it's more of the case where it's split between more restrictions and restrictions were about right. And a quarter in those countries say that fewer restrictions would have been better for their country. Greece is actually one of the few exceptions here, where 43% say fewer restrictions would have been right. And that's an interesting sort of example here where there are differing opinions. And then, of course, in the US, generally the sentiment is that more restrictions would have been better, with 56% saying that versus only 26% who say fewer restrictions. When you look at it in the Asia Pacific, another country that again jumps out to us is Japan, where 62% say there should have been more restrictions versus only 8% who said there should have been fewer restrictions. South Korea is a little more mixed, where 46% say they were about right versus 39% who said there should be more. And then in the other Asia Pacific countries that we survey, a pretty strong majority say the restrictions were about right. And I think that speaks to the data that I showed earlier, that people were pretty happy with their country's response to COVID-19 as of the March-April time period. Again, with the Delta variant, it would be very interesting to see if these figures have changed, especially, our plans are to ask these questions again in these countries next year. And it will be very fascinating to me, at least, to understand if any of this data has shifted over that time period, especially as the course of the pandemic changes with the ebbs and flows and the vaccination campaigns within all of these countries. And we might ask about vaccines too, but that's obviously something that's pretty fast moving when you think about it from a public opinion standpoint. One interesting note about the restrictions, and this speaks to more of the politics, is that those on the right, so those who place themselves on the ideological right, which the way we sort of do that is those who place themselves on a 4, 5, 6 of a 0 to 6 point scale when we ask them about their political ideology. Those on the right are far more likely to say that there should have been fewer restrictions on public activity over the course of the COVID-19 pandemic. Now, this sort of aligns with what we already know, that those on the right are a little more, likely to say that they're a little less likely to want these restrictions, to say that they're necessary, or to even say that the government is doing a good job of it. But you also see here too that the U.S., even though there's a divide in all these countries, the divide in the U.S. is bigger than all the other countries. We see this a lot in our data, where you see political polarization around the world in many countries around the world, but typically the United States is the most politically polarized, and that sort of comes out in this data as well, even though in all those other countries there are political divisions here too on whether there should have been fewer restrictions on public activity. But it's an interesting thing to note, how big a gap it is in the US versus the other countries. And this is it for the rest of the countries that I surveyed. I said earlier, Greece is a bit of an exception, where those on the left are more likely to say there should have been fewer restrictions on public activity. It's the only exception here, and that comes to a lot of who's in charge of the country. Often, that can play a role here. Also, the left-wing populist party in Greece, which has been sort of more against restrictions, that's different from the other countries, where generally supporters of right-wing populist parties in Europe tend to be more likely to say that there should have been fewer restrictions on public activity versus those who do not support those parties, such as AfD in Germany or National Rally in France. So that political division is really interesting, but it's not universal. But for the most part, those on the right are more skeptical of restrictions, and we've seen that in our past data as well. And so what does this all mean? When you add this all up, what does this show? Well, I think one of the more interesting questions that we asked is whether people think, did the coronavirus pandemic, did this outbreak make their society more divided or more united? And the most interesting thing about this question is not even the results, in my view. It's sort of the change since last year. So in 2020, when we posed this question to publics around the world, whether their society is more or less divided because of the pandemic, most people said their countries were more united. 66% of Canadians in spring of 2020 said their country is more united because of the pandemic versus 29% who said they were more divided. But in just 1 year, that number has completely reversed. Now, 61% of Canadians say their country is more divided now than before the coronavirus outbreak, and 36% say they are more united. This is a really big change. You don't often see public opinion shift this fast, and I think it really speaks to how at the beginning of the pandemic, there were thoughts that maybe this is something to unite us. Maybe this is a way to sort of put aside political differences. But in the end, those political differences sort of manifested and in many ways were magnified by the outbreak. And now we see that in many of these countries, strong majorities say that their country is more divided than before the coronavirus pandemic. And it applies to, most of the countries we surveyed, even in the United States, where in 2020, it was pretty clear that people thought society would be more divided. 77% said that. That number also went up to 88%, which is very high when you're talking about public opinion. But the pattern is quite clear here. Politics, people do think that coronavirus has divided their publics more than before. And this is pretty consistent across the countries we survey and across the regions we survey. And also another sort of interesting point about the most recent data is that young people are actually the ones who think that their lives will be most impacted by the coronavirus outbreak. We asked whether people say their life has changed a great deal or a fair amount as a result of the coronavirus outbreak. And here, young people in most of the countries we surveyed are more likely than older people to say that it has affected them. So 77% in the Netherlands, for example, who are 18 to 29, say that the coronavirus outbreak has changed their life a great deal or a fair amount, versus only 49% who say that among our oldest cohort. So this is also another interesting thing that we see, that there is sort of an age divide that's sort of popping up here when looking at coronavirus outbreak. And in past research, we also found that there was a bit of a gender imbalance, that women felt like their lives were also being more affected by the coronavirus outbreak than men, although some of those gender differences are less prominent than they were last year. I'm not really sure why that would be the case, but there does tend to be, in some countries, a bit of a gender divide here on the impact of the coronavirus outbreak. Finally, a little bit of positive news is that we asked the question on whether they think their survey public's healthcare system can handle a future global health emergency, whether they have confidence in that or not. And generally, majorities in most of the countries we surveyed did say that they have confidence in their healthcare system's resilience in future emergencies. So 75% in Canada, 83% in Sweden, 75% in the Netherlands. The US is a bit lower on this, generally a little less faith in the US healthcare system relative to the other countries in which we asked this question, but still a majority do say that the healthcare system could handle a future global health emergency. And this also is the same kind of pattern that we see in the Asia Pacific. So overall, almost 3/4 of those that we surveyed say that, they think their survey public's healthcare system can handle a future global health emergency. So one of the positive things that we found in our most recent data, among some pretty gloomy numbers otherwise. So with that, that is pretty much my presentation. If you have any questions about any of the data that you've seen within, I'm happy to answer questions. If you have questions about the methodology, why we surveyed in the countries that we surveyed, happy to go into any of that detail. Or if you're interested in more of what Pew Research does, both in our international work or domestic work, I can try to answer some of those questions as well. But for now, I will hand it back to Catherine, and we can start our Q&A.
Jacob, thank you so much. This really detailed overview of some of the issues. I wanted to ask those in our audience to submit questions through the link on the page where they're viewing this. But while people are gathering some of their thoughts, I just wanted to ask you to say a little bit more about the field work. I think in normal times you would do face-to-face field work, right? But the pandemic had kind of forced you to shift to online or phone interviews. And so just wanted to ask you to say a little bit more about how the pandemic has shifted the way that you and your teams work, and how do you anticipate sort of adapting? Have there been any benefits to this kind of change, or how do you anticipate changing in the next round?
Right. I mean, as with anyone else, our work was greatly affected by the pandemic. in a typical year, we would survey about 30 countries around the world with a good mix of sort of emerging and developing nations and then more advanced economies. And you'll obviously note in this survey, it was much more focused on the advanced economies. And the reason of that is just methodology. We employ face-to-face survey methodology when doing interviews in emerging and developing nations, such as South Africa, Nigeria, India, Brazil, Mexico, even in Eastern Europe, like Poland, Hungary, Russia, or the Middle East, Israel, Turkey. In the past, we've employed face-to-face interviewing, and that means literally face-to-face. We have interviewers who go into towns, who walk around the town in a predetermined pattern, knock on people's doors, and then sit in their home from anywhere from 30 to 45 minutes going through our questionnaire. They use a tablet to sort of track the responses, but in the end, they have to talk to these people in their homes. And there's a public health issue with doing that kind of research. And so we decided pretty early on in the pandemic that until we were comfortable with the kind of like national health groups and the sort of public health issues, that we'd be comfortable employing that again, we would basically put a pause on face-to-face surveying. So that means in the interim, what we're trying to do as an organization is think of other ways to contact people in a nationally representative way. One way would be to switch to phone surveys, as we do in the other countries we survey. But there's issues that come into play with that. Often when you do a phone survey in more emerging and developing nations, you do not get a representative survey. You get people who are more urban, you get people who are more educated, higher incomes, and that tends to skew some of these results. We like to be nationally representative. The other option is online. There's also issues with that, sort of the same issues as with transferring to phone, is that you get a more educated, more high income sample. It's also hard to know whether people who join are real people. And that's a problem overall with online survey research. And we're not closing the door to that kind of research, to adapting to that. But in the interim, we do think that face-to-face methodology is the best way of surveying in these countries. And until that's a viable sort of option again, we probably won't be surveying in those places. And that's despite the fact that we're missing a lot of interesting data from a large portion of the world, and that is not personally that's hard for us to take, because we want to be able to speak to the global population. But in the end, in this time period, we're doing our best to sort of keep safety first in mind, and hopefully in like a year or two, we'll be able to go back into the field in some of those more emerging and developing nations and sort of see how the pandemic has affected their attitudes.
Well, it sounds like there are some good opportunities to really kind of gather retrospective data about how people have gone through this whole period, once you're able to get back into the field. So we've had a question come through that I think builds on some of what you showed about the different demographic groups' experiences of the pandemic. And, it looked like young people in particular were more likely to say that their lives had been changed. I don't know if that was good or bad, or, if you looked into whether it was positive or negative. But, we've also had a question come in from one of our colleagues in the International Security Program, really asking about, how the understanding in these economies of the impacts on children. And so it looks like the group that you surveyed was a little bit older than children, but still young people. But do you have a sense, were you able to ask people about, how they perceived the effects on children, the closing of schools and the lack of social engagement and all that kind of thing? Do you think that feeds into some of these perceptions of social division? And, what would you need in order to be able to say more about, the experience of children during this period?
Yeah, I think there's a lot of research in the U.S. about how it's sort of impacted families and women and children a little more than it has others. And I think Gallup has some research from its global poll about how women are the most affected by this. So yeah, I think there is I think there is a lot to say here that children, the future path of children in these countries might be affected by this pandemic. But in the end, we haven't really started to explore those aspects of it. We were sort of, first to sort of measure how people feel about the reaction to it. And I think over the next couple of years, we'll really be able to dig down on what were the long-term effects of the COVID-19 pandemic on healthcare, on schools, on education, on politics, on how people feel their family lives have been impacted. I will say, though, we did ask a question this year that we actually ask almost every year, and it's whether people think that children will be better off financially than their parents will be in the future. And on this, about two thirds across the countries that we surveyed say that their children will be worse off than their parents financially. So there's generally a sense of sort of pessimism about children's future in many of these countries that we survey. Again, I will caveat that in saying that we're not surveying in the emerging developing world. We're not surveying in China and India, and there might be differences of opinion in those countries. But across these 17 advanced economies, there is a sense that children are not getting the benefits or getting the opportunities that they had when they were children. And there is sort of like a pessimism about the future, even as overall economic attitudes have rebounded a bit from last year at the beginning of the pandemic, when it looked like it was going to be more of an economic crisis as well. And while that has played out in sort of micro levels and the macro level, that's not as sort of an issue. People are saying that the economy is better off this year than they did last year, even if they're saying that their children will be worse off in the future financially than their parents.
Interesting. So we have another question here from one of the members of the audience. Really, here we are, looking at the wrap up of the Olympics in Japan. Of course, they had to be delayed from last year to this year. And the question is, looking at some of the data that you have about responses in Japan in particular, do you think the Olympics played a role in terms of the public in Japan feeling like they wanted more restrictions around COVID-19? And did you see kind of a change in attitude around this particular issue from last year when the Olympics were meant to have been held to this year when they have been?
Yeah, so I mean, overall, Japan does stick out as both the country which is most likely to say there should have been more restrictions across the 17 that we surveyed, and the one that said their country is doing a bad job of it. About just over 6 in 10 on both those questions among Japanese. And opinions in Japan have deteriorated since last year when we asked about this in the first place. So, it's likely that views of the Olympics sort of interplayed here. It's probably more so, though, that the conditions on the ground changed, that the vaccination campaign was a bit slower than in other countries, that there were, popping up more cases than there had been in the past. So overall, Japan does stick out as sort of one of the most negative on views of COVID-19 in terms of their country's response and on restrictions. There were other polls in Japan that said, about a third said that the Olympic Games should be canceled. I know there was a lot of concern about it potentially increasing the spread of COVID-19. We went in, our field period was a couple months before it actually happened. To me, it will actually be interesting to see what happens after the Olympics. Will, the sort of negative pessimism continue afterwards, after, the event happened, depending on what goes on in Japan after the event, or will it just revert back to what people said in the previous years? But yeah, those kinds of international events do have an effect on public opinion, and I imagine Japanese were considering their responses, as part of knowing that they were going to host the games and knowing that there was a chance that could increase the likelihood of outbreaks within the country, especially coupled with like a slower vaccination campaign.
Right. So you, in presenting the data, particularly I think around the positive feelings, or whether there was a greater feeling of union after or in 2021 as opposed to 2020, the United Kingdom was really kind of an outlier in terms of the direction of the graph, and really showed a positive response in terms of the government's response. And so I just wanted to ask if that was surprising to you. You said, well, this was done in March and April when the vaccine, campaign was being rolled out and, was viewed as being more successful than what was happening in Europe at the time. But, was that surprising? And, just to what extent were you and your team, shocked or surprised by some of the findings that you've had?
I mean, I think that does speak to the field period in many respects, that the UK vaccination campaign started earlier, and sort of that led to people being much more positive about how things were going, especially when you compare it to 2020, when there was, a pretty big spike in the UK, that, there was a lot of restrictions put in, a lot of questions about the government's response, which we see in our own data, pretty negative views of the response, both in spring. I think we even had a survey in the fall, which showed sort of more negative views of the COVID response in the UK versus even some of the other countries that we surveyed in Europe. So yeah, there was a positive movement, and that's because during the time when we surveyed, vaccines had picked up. And we, just to speak to a couple points that you didn't see in the slides that, I know from our own research. One is that there was some change over time in the views of the coronavirus response, both within countries and in views towards the US, as the US vaccination campaign sort of started to pick up, where there was slight improvements in those saying that the US had done a good job of dealing with the outbreak. So even within the field periods, you see some differences between like the beginning of the field period and the end of the field period in terms of attitudes. And again, public opinion is very sensitive to facts on the ground. And that's the second thing I wanted to say, is that we actually threw together a correlation on these countries on, whether people say that the coronavirus response is good versus deaths, the number of deaths in the country due to COVID-19. And there is a correlation, in the countries with higher death rates did tend to be more negative on their own country's handling of the COVID-19 outbreak, whether you do it in a logarithmic scale or whether you do it on a per capita basis. So facts on the ground, what people see around them do matter in these public opinion kind of surveys, and they can change over time, which is one of the reasons why we try to ask the same questions over and over and over again, because we do see changes over the years. And it's really important to know what those changes are, because, a number by itself in isolation doesn't always tell you the whole story. It's often important to know where that number was and where that number is going to be in a year. And that's why we sort of try to ask these surveys at a similar time, year in, year out. And we'll probably do it again next year to see how things have changed over that time period.
So one of the questions that, has come in is from a colleague in our development office, who has, just asked for a little more, if you could describe a little more detail, when people say that they feel like their countries are more divided, are there specific issues? Are you able to kind of drill down and find out what do they mean when they say divided? What is their sense, or are there specific issues that you ask about?
Yeah, so on this particular question, on the divided united question, we made it very distinctly in the realm of coronavirus outbreak. We didn't ask, is it, what's dividing the country beyond that? So here, when we say that, when the people say to us that their country is more divided than it was, they're talking about because the coronavirus pandemic. They're not talking about any other particular issue, although, politics is involved in that. Obviously, there's a lot of divisions within countries versus whether people support the party that's in power versus the party that's not in power. In Europe, there's divisions based on whether you support right-wing populist parties versus not supporting those parties. And of course, as I showed earlier on the restrictions, on whether there are enough restrictions or not, there's an ideological divide. And as I said, too, in the United States, it's more pronounced than it is in the other countries, but it's true on a lot of issues that we ask about. It often comes into play when talking about democracy, when talking about international views of the United States, when looking at economic attitudes, looking at threat perceptions. These kinds of ideological divides are pretty common across the countries that we survey, but of course it depends on what kind of question you're asking about. For example, if you ask about whether climate change is a threat, people on the left are going to say it's more of a threat than people on the right. if you're saying that international migration is a threat, people on the right are going to say that's more of an issue than people on the left. Same with sort of like international terrorism. So it really does depend on the topic that we're talking about. But in this case, the divisions that people are seeing in society, we did probe specifically on the coronavirus pandemic. Later on this year, we're actually going to release some data on whether people think there are conflicts between people within their country, different religious groups, different political groups, people living in cities versus rural areas. Really interesting data that we have right now, but we haven't finished analyzing it. It always takes a bit of a time to kind of do that analysis. But the Pew Global Attitudes Project will put out that data later on in the fall and sort of speak to some of those more kind of divisions related to democracy and unity. And I think that would be some really fascinating stuff once we get through the analysis, which is ongoing over the summer.
So it sounds like more detail will be forthcoming. So we'll stay tuned. So, one question that some of this has raised for me is, the extent to which you've been asking people some of these same questions over a number of years in the past, and you ask people to rank themselves in terms of their political affiliation. I guess 1, 2, and 3 are more to the left, and 4, 5, and 6, you said they identify as more to the right. Have you seen over the course of the pandemic any kind of shift in terms of how people identify themselves politically? And is there any relationship between that and how they see themselves divided or united?
Yeah, it's a good question. It's always a little hard to sort of see those kinds of shifts because they tend to be a little more steady than one would imagine. Ideological orientation tends to stay the same over the years. It's not always the case with sort of when you're talking about specific parties. People can sort of say they're more affiliated with one party versus the other based on who's in charge, based on conditions on the ground, on the political fortunes of that party or not. But generally, though, the ideological divides within these countries have remained steady as far as I understand the data over the past couple years. But that's not to say A, it won't shift, or B, it won't change the degree to which the divisions are in place. I mean, as I said, earlier, the U.S. is an outlier in this case, tends to have more political divisions, but we're also seeing more political divisions crop up in a lot of these other countries. And there could be multiple factors why that is. It could be the rise of the internet. That's one supposition that has fractured societies in a way. And we do know from our own research that internet use, if you just look at it from 2008, 9, 10, just 10 to 12 years ago, it was not ubiquitous. Not everyone had the internet. Not everyone had a smartphone. Not everyone used social media. And that's a real change in how people sort of function and react. And it's an open question on how much that affects people's attitudes, but it's something we're definitely looking at sort of probing in the future to see what those effects are. I mean, overall, in all the things that we track and all the data that we track, we like to have a consistent basis of within the country, similar demographics from year to year. And again, that does usually mean that the ideological groupings stay the same. But there have been some shifts, like in Europe, for example, a little less support for populist parties, a little more support for green parties over the last couple of years. So there could be shifts like that, in other places as we continue to ask these questions. But it's an interesting to think about because it does, it's one of the major demographic attitudes that really does affect how people think about various things in their lives, not just something as big as the coronavirus pandemic.
Right. So many different factors could be shaping people's fairly slow transitions one way or another ideologically.
Yeah.
We've got another question here that touches on some of the data you presented around confidence in the healthcare system. And the question, is the extent to which you saw differences in terms of belief in the resilience of the healthcare system from people living in countries where there's more broadly universal health coverage versus countries where it's either a more fragmented system or more reliant on private healthcare. Do you have, have a sense?
I'm not an expert in healthcare systems around the world. It's something we've talked about looking more into in terms of, potentially looking at, healthcare expense versus how people view, their healthcare system and how it's dealt with coronavirus. But I will note that the U.S. is the lowest percentage on those who say that a future health emergency, that their country can deal with it. 55%, which again is a majority, but it's the lowest percentage across the 17 publics that we surveyed. So you do see in the United States a little less sort of confidence that the healthcare system can handle future emergencies. I mean, maybe you can speak to more whether there are other countries where there are more, centralized healthcare systems. Obviously Sweden stands out too. Sweden and the UK both had very positive views that their healthcare system could handle a future emergency. Singapore, another country, I think those are both sort of classify into countries with more universal healthcare. But correct me if I'm wrong there.
Well, I mean, also just the question, as you said, of centralized versus, a federalized system where you have, one set maybe of national standards, but then state standards and local authorities all kind of dividing responsibilities and making decisions would be an interesting thing to look at. And maybe that's something that, as you all are able to go back to your more expanded research and really talk to people face to face, that some of that can really come forward. I know we're about out of time, and so I just want to ask you to reflect on really not only the extent to which the pandemic has affected some of the work that you were able to do over this last period between 2020 and 2021, but to reflect as well on how what some of what you're learning during this period will shape the projects and some of the approaches that the Global Attitudes Group will be looking for in the short to medium term future as well.
Yeah, I mean, overall, the public opinion is really valuable in these time periods, because it does give you a way of getting a sense of how people are feeling about a major global issue at the time. So just having this data, being able to conduct these surveys, even in a more limiting way, we think is a really important contribution to the public dialogue. And what have we learned? It's probably it's probably a bit dangerous to rely on face-to-face interviewing in a lot of these places going forward. We don't know when we're going to be back to normal, where it's going to be okay to do this. But as much as we can move to kind of more either phone-based or web-based surveys in the future, once we're confident in the methodology, which is a huge sticking point, but once we are, to probably try to transition a bit to that. We've already done it in the United States, but that's basically because we built our own panel that we were confident in, that we were confident in the demographics, that we are able to track easily. But internationally, it's a whole different world. So that's something that I think we're taking from this. The other thing is, how to adjust to a world where we don't get to talk to audiences in person. As you're sort of dealing with, we have to do more of these kind of virtual seminars, or we have to find outreach in different ways. And I think we've adapted well to that. We've kept up the number of briefings we do. We still talk to people around the world. At the same sense, we don't want to be bottled in here. We don't want to just our own views sort of reinforce themselves as we keep on talking to the same people. So, that's something that I hope in the future we can get back to exploring. In a lot of ways, we're doing that even on the research side. We're going more into qualitative work, focus groups, deliberative interviewing, cognitive interviewing, where we sort of get a sense of why people say what they say to us, using open ends on surveys where people can just sort of start talking about what they think about when they think about China or the coronavirus pandemic or the meaning of life even. And I think those are all very research-oriented ways in which we can shift the data. Getting more voices of the public, getting more voices of people in our work is something that we're trying to do more of, but not disregard the survey aspect of it, but maybe just round it all more into a nice package that people can really know why people are saying what they're saying. Because again, we do care about what ordinary people say about these things, because we do think their voice matters, and that inserting it into the conversation is benefit to all of us.
Well, Jacob Poushter, Associate Director at Pew Research Center, thank you very much for coming today to share the results of your recent survey on social attitudes around society and division within advanced economies in North America, Europe, and Asia. really appreciate your taking the time to speak today, and good luck to you in the continuing assessment of the current survey results and in your future ones as well.
Thank you, and thank you very much for having me. It was a fascinating conversation.
Thanks.